News 17 Health Watch starting us off this morning. September marked the 11th annual NICU Awareness Month, created by Project Sweet Peas to highlight newborn hospital patients and their families. But what are the hardships that they face? Well, it turns out giving birth can be just the beginning of a long road of challenges for preemies and their parents. Imagine finding out by surprise you're pregnant, and then the doctor tells you it's not just one, but two babies. And not only are you having twins, but they need to come out early to survive. For the Strickleys, this has been their reality for the past 7 months.
You expect a full-term baby, you expect, oh, I'm going to have the normal experience, you birth your baby and then you go home. Family comes to visit. We had none of the norm. We had, the doctor visits every week. We had the babies come early, we have the NICU experience, and we have no family. So, none of the norm.
In August, Kelsey and Trey welcomed Ridge and Gunner to the world. Ever since, their lives have been confined to the four walls of the NICU at Memorial Hospital.
The NICU experience is, for sure, I think, a lot harder than if you would have just had a full-term, healthy baby. Even being twins would have been nice to go home with two healthy babies. Yeah, the NICU part is pretty challenging. It's like feeling like you're having supervised visits with your own children.
The neonatal intensive care unit at the Lawrence Mall Children's Center at Memorial is home for up to 31 infants at a time, all within their first month of life. More than 250,000 newborns in the U.S. spend time at a NICU each year, almost 1 in 10. Neonatologist Dr. Sudhir Patel spent the past 33 years learning about the resilience of these newborns. He says he's still learning.
40% of the time we actually are doing the right thing. 40% of the time we're not causing any harm, but 20% we are. So it takes the whole of your life to learn about that 20%.
Staying at the hospital for an indefinite period is a tough reality for many parents.
Leaving the hospital without them was pretty hard. And then every day leaving without them is hard. So every time you're away, you're just like, oh, I should be there. But you also have to recover yourself so that you can care for them.
Kelsey knows firsthand how difficult NICU moms have it.
The babies they're getting plenty of support 24/7, but the moms tend to be forgotten about, and there's certain things you should and should not ask a NICU mom, I think, that people are not aware of.
These are questions that minimize the situation, imply guilt, or provide unsolicited advice. Experts instead suggest offering to help, being a present listener, and acknowledging the mother's reality. They're overwhelmed with love, fear, and exhaustion, all in the face of the unknown.
It'll mentally break you down if you're here 24/7.
You have to go home, you have to get some rest, you have to take care of yourself, eat. Things can happen fast with small babies that are in the ICU, so just be prepared for kind of whatever comes your way and hope for the best.
And the best is still yet to come for the Strickley family. A few days after we sat down, baby A, or Ridge, went home for the first time. And baby B, Gunner, could not be without Ridge for too long. He finally joined his brother at home 2 days after. With 3 decades of learning, practicing, and changing, Dr. Patel only has one word to sum up the work of neonatology.
It's miracles. I don't know how it happens, to be honest with you. So there's something special going on with some of the babies.